hope everyone is safe and sound. Myself, Dr. Surya, and I will be discussing the recent Kerala University of Health Science Periodontology question papers. As we all know, perio is a very vast subject, and hence all the questions cannot be discussed in one section. So I have divided this question paper discussion session into 4 to 5 parts. So today I'll be discussing questions from 6 chapters, and for each question I have added references also. I hope this is really helpful for you guys. If you have any doubt or query, please do clear them in the comment section. Before commencing, I would like to thank Dr. Zahir for giving me this wonderful opportunity. So coming to the first chapter, that is biology of periodontal tissues. Now, if you guys have observed any university question paper from perio, there will be definitely one question from the normal periodontium. That is at least one question from either gingiva, periodontal ligament, alveolar bone or cementum. Okay, so you have to be thorough with these 4 chapters. Coming to the first question, what is dento-gingival unit, and discuss about the junction epithelium and add a note on its development. So this is a direct question from chapter 1, gingiva in Carranza. I have even added the page number for your references and convenience. So coming to the contents of this answer, so first part, that is what is dento-gingival unit. It is nothing but the gingival fibers and the junction epithelium, they together form the dento-gingival unit. Coming to the second part of the question, discuss about the junction epithelium. So in this section you have to add about what is junction epithelium, what it consists of, what are the layers, what are the structure, what are the zones, and what is the function of the junction epithelium. So what is consist of is nothing but the stratified squamous non-keratinized epithelium, and then you have to write about how many cells wide it is present at the coronal aspect and the apical end, and then what is the length of the junction epithelium. Then coming to the structure of junction epithelium, in the structure you have to write how the junction epithelium is attached to the tooth, that is via the internal basal lamina, and how it is attached to connective tissue, that is with the help of the external basal lamina. Then coming to the zones of junction epithelium, there are 3 main zones. It is given in Carranza, and the uses has also been mentioned. Then coming to the functions of junction epithelium. So functions, there are 3 main functions that is written in Carranza, and all the 3 should be mentioned. It is very important. Now coming to the development of junction epithelium, the answer for this question comes under the heading development of gingival sulcus, which is also given in chapter 1 gingiva. Okay, so in short I will just try to explain the development of junction epithelium. It is nothing but the confluence of oral epithelium and reduced enamel epithelium during the tooth eruption. Now coming to the second question, that is what is periodontium, discuss in detail about anatomical and histologic features of healthy gingiva. This is also a straight cut question from the first chapter gingiva. The first page itself they have mentioned what is periodontium. So first you have to write the definition of the periodontium and also mention the 4 components, that is gingiva, periodontal ligament, cementum and alveolar bone. Then coming to the second part of the question, that is discuss in detail about anatomical and histologic features of healthy gingiva. So before you start about this question, first just mention what is gingiva and then come to the anatomical features. Now anatomical features are nothing but the macroscopic features of gingiva, which includes the 3 parts: marginal gingiva, attached gingiva and interdental gingiva. Along with this, please do mention about the gingival sulcus also. Now coming to the second part, that is the histologic features. In histologic features is nothing but the microscopic features of the gingiva. So in this part of the question, you have to add about the various layers of the stratified squamous epithelium, that is the stratum, corneum, basal, etc. You have to write in this part. And then once you have mentioned about the 4 layers of the stratified squamous epithelium, then you have to mention about the gingival epithelium. And under gingival epithelium, add a note on oral epithelium, junction epithelium and circular epithelium. And after that, write about the gingival connective tissue, then about the gingival fibers, and also mention about the dentogingival unit. Coming to the next question, that is the short essays. So short essays, they carry like 5 marks each, so you have to write a bit in detail, but not as long as a long essay. So coming to the first question, structure and functions of cementum. This you have to refer chapter 2, tooth supporting structures in Carranza. The page number has also been mentioned. So under this question you have to write, first mention what is cementum, then the types of cementum and Schroeder's classification. The diagrams are needed. Under the types of cementum, you have to show where the radical cementum is present and where the coronal cementum is present. And also the Schroeder's classification, the types of cementum. If you draw a diagram mentioning all the different types of cementum, you will fetch more marks. And then coming to the functions of cementum, the 5 functions I have mentioned here. That is, the cementum helps in tooth support, it maintains the integrity of the root and its position, it provides attachment to collagen fibers, it helps in repair and regeneration, and since cementum is harder than bone and it is avascular, it does not undergo resorption under any sort of masticatory or orthodontic force. Now coming to the next short essay, that is, classify cementum, describe about structure and function of various types of cementum. It's already discussed. So I'm moving over the next question, describe the structure and function of periodontal ligament. So this also you have to refer the periodontal ligament chapter 2, that is the tooth supporting structure, and what all contents you have to write is, first define periodontal ligament, write the structural components. Under the structural components, write about the cellular elements and the principal periodontal fibers. And coming to the function, the first function is the physical function. So under the physical function, do write about the resistance to impact of occlusal forces. Mention the 2 theories, the tensional theory and the viscoelastic theory. And then write about the transmission of occlusal force to the bone. So into this you have to write what happens when an axial force is applied and what happens when a horizontal or tipping force is applied to the bone. Okay, so that comes under the physical function. Then write about the formative and the remodeling function. In the remodeling function, please do write about the turnover rate of the periodontal ligament. Then coming to the nutritive and the sensory function. Draw the necessary diagrams. Please do draw the periodontal ligament fibers diagram. That is more important. Now coming to next one, that is, describe the structure of junction epithelium. That is already discussed. Then next question is describe the microscopic details of gingiva and classify the gingival bleeding. So the microscopic details of gingiva I have already discussed. So in the microscopic features, you have to write about the oral junctional circular and also about the gingival connective tissue fibers, mention about the dentogingival unit. Then coming to the classification of gingival bleeding, you have to refer chapter 13, clinical features of gingivitis in Carranza. Now coming to short notes, first question, anatomy of alveolar bone. So for this, refer chapter 2, tooth supporting structure in Carranza, page 28. So under this question you have to write, first define the alveolar bone and write the parts of the alveolar bone with the diagram. Next question, principal fibers of periodontal ligament. So in this you have to mention about the 6 principal fibers of the periodontal ligament. So before that, do mention about what is periodontal ligament and then the structural components, and then describe in detail about the periodontal fibers, and please do draw the diagrams. Now coming to the next question, cells in the periodontal ligament. Here also, first define periodontal ligament, Then write the structural components, two types, cellular elements and periodontal fibers, and then write in detail about the cellular elements. Please do the diagram. The next few questions I have already discussed, that is the classification of cementum. You have to write the Schroeder's classification as well as the other classification, that is the cellular, and also the coronal and the radicular cementum. Then dentogingival unit of is also mentioned, also discussed already. Then gingival fibers is also mentioned. You have to do a diagram for the gingival fibers. Then coming to the next, that is the clinical significance of attached gingiva. Refer chapter 1, gingiva. Under that, the macroscopic features, the attached gingiva will be there. Draw the diagram for the attached gingiva. Label where the attached gingiva is, where the mucogingival, and where is the alveolar mucosa. Now coming to the second chapter, that is the dental plaque. So the long essay, first one is describe dental plaque as a biofilm and add a note on steps of dental plaque formation. You have to refer chapter 8, biofilm and the periodontal microbiology in Cavenza, page number 99. So the contents coming for this answer is, first you have to define dental plaque. Preferably please use the definition given by WHO. So once you have defined dental plaque, define what is biofilm and then write about the structure of dental plaque. If possible, classify the dental plaque, that is the supragingival and the subgingival dental plaque. And structure of dental plaque is nothing but how it looks microscopically, the supragingival as well as the subgingival dental plaque. Then coming to the formation of dental plaque, the three main steps has to be mentioned, that is the formation of the pellicle, initial adhesion, colonization and maturation. Coming to the second question, define dental plaque. Again, it's already discussed. Describe in detail about the mechanism of plaque formation. You have to write the 3 steps and then different plaque hypothesis. Okay, so coming to this plaque hypothesis, you have to mention the 4 main plaque hypothesis, that is the specific and the non-specific plaque hypothesis. The ecological plaque hypothesis, it has a diagram, and also then the recent one, that is the keystone plaque hypothesis. Please don't forget to mention the latest plaque hypothesis, that is the keystone plaque hypothesis, and draw the necessary diagrams. Now coming to the short essays, the first question is already discussed, define and classify dental plaque and what are the various plaque hypotheses. Then next question is classification of chemical plaque agents. Okay, so when you write this question, first define what is dental plaque and then write about the plaque agents. So there are 2 types of plaque agents, that is first is the chemical plaque agents and then the mechanical plaque agents. Mechanical plaque agents is nothing but our toothbrush, toothpaste, interdental aids, etc. And then about the chemical plaque agents, which you have to refer chapter 35, plaque biofilm control in Cavenza. Coming to the short notes, stages of plaque formation, you have to write the 3 stages: formation of pellicle, initial adhesion, and third one is colonization and maturation. So the 3 steps stages you have to write in this particular question. Now coming to the second one, that is the ecological plaque hypothesis. So when you're writing this answer for this question, first define what is plaque, then write the 4 hypotheses and then write about the ecological plaque hypothesis. There is a diagram also for this plaque hypothesis. Please do draw that. Now coming to the structure of biofilm, that is already discussed. Now coming to the next question, that is the Sokransky criteria for periodontal pathogenesis. So because this was not there in the Cavenza, I have written it. So Sigmund Sokransky, he was a researcher at the Forsyth Dental Center in Boston, and he had modified the postulates. So according to him, there are 5 postulates. That is, first is the association of the lesion, second is the elimination of the suspected organism, third is the host response to the organism, fourth is animal studies, and fifth is the virulence factors. So these 5 criteria you have to write under this question. Coming to the third chapter, that is calculus and other etiological factors. So the long essay, describe the role of iatrogenic factors in the etiology of periodontal disease. This is a straight cut answer from chapter 10, the role of dental calculus and other predisposing factors. So here the iatrogenic factors for you to include are the contours and the open contacts, the margins of the restoration, the materials that is used for restoration, that is for the cap, the acrylic. Sometimes as a temporary cap they give the acrylic cap. So in acrylic cap what happens is there will be plaque accumulation. So those are the iatrogenic factors. And also design of RPD, FPD, the restorative procedures like the use of rubber dam clamp, matrix band, etc. They can lacerate the gums. So they come under the iatrogenic factors of in the etiology of periodontal disease. So please refer chapter 10. Next is the short essays from this chapter. First is the differentiate between supragingival and subgingival calculus. So there is a table that is given in Carenza for this question. So please do refer that table. So, but that is a very short for a short essay. So that's why you have to add to the bulk of this question. So that is, first you have to define the calculus, then classify the calculus, and then write that table. So that will fetch you 5 marks. Now next question is explain the mineralization of calculus. So for this you have to refer chapter 10, role of dental calculus and predisposing factors, page number 121. So again, coming to the content of this question is first define calculus, classify calculus, and then write about the formation and mention the theories. Just mention the theories, no need to explain it. Now coming to the next question, that is theories of calculus formation. So for this question, please define calculus first, then classify the calculus and write about the theories. And coming to the next, that is short note, bruxism. Okay, so because short notes are like 3 marks, you don't have to write this much sentences. Just write what is bruxism, and then just mention about the etiology and the symptoms, and please do mention about the consequence of bruxism on periodontium. I've written it in the point wise. So all these points is needed for this question. And treatment, if you want, you can write. Okay, so for 3 marks, please don't forget to mention the consequence of bruxism on periodontium. Next one is management of cervical dental hypersensitivity. So first you have to define what is dental hypersensitivity, and then how it is characterized, and then mention about the management, that is the treatment approaches. So I have written it here under 3 headings. First is the patient counseling, second is the interventional treatment, and third one is the blocking the neural transmission of the pulp. Next one is role of genetics in periodontal disease etiology. So here also the answer for this question is towards the end of chapter 10, the role of dental calculus and other predisposing factors. So first write first give a little bit introduction, okay, and then write about the studies. That is, there are a few studies that has been given, that is the familial study, segregational study, linkage study, twin study, and all. And then also do mention about the role of genetics in aggressive periodontitis. Coming to next question, that is food impaction. So for that, refer chapter 10, role of dental calculus and predisposing factors, and then also refer chapter 19, that is the bone loss and patterns of bone destruction, page number 125. So in this chapter 10, it comes under the iatrogenic factors, that is the contours and the open contacts. In that they have mentioned about the food impaction, and also please don't forget to mention about the plunger cusp. Next question is iatrogenic factors, which is already discussed. Now causes and sequelae of food impaction, again refer the chapter 10 and chapter 19. The sequelae of food impaction I have mentioned here, this point in point wise, please do refer this. Now coming to the classification and epidemiology of periodontal disease. So the first question is classify periodontitis and then discuss the etiology, clinical features, radiographic features of aggressive periodontitis, and add a note on management. It's a very lengthy answer, so time management is important for this question. So classify periodontitis, that is, for this you have to refer the classification chapter in Carranza, and then you have to, for the second part of this question, that is on aggressive periodontitis, refer the chapter 22 aggressive periodontitis, and whereas for the management, refer management of aggressive periodontitis chapter 31. Coming to short notes, that is the gingival index is a most commonly asked question. So for this you have to refer chapter 6 epidemiology of gingival and periodontal disease. First mention what is index and then write about the gingival index. Also write about the scores and the interpretation for the gingival index. Coming to oral malodor, so the most commonly asked question is halitosis and etiology of malodor. They will ask usually as a short note or a short essay. Okay, so halitosis and etiology of malodor, you have to refer chapter 41 breath malodor. So for halitosis, you have to first define halitosis, write the etiology, write how we can diagnose malodor, and write the treatment part. Etiology of malodor, refer the chapter. There are local as well as the systemic causes. So please refer this chapter. Coming to the next chapter, that is smoking and periodontal disease. So the first is the long essay. So describe the difference between risk and etiologic factor. Enumerate various risk factors associated with the periodontal disease and describe in detail the smoking. Okay. So for this, you have to refer chapter 27 clinical risk assessment in Carranza, page number 299. For the first part of the question, you have to refer chapter 27. So in that chapter they have described what is risk factor and what all comes under the risk factor. That is the second part of the question. Also for that also you can find answer in this chapter 27. And for the third part of question, describe in detail the smoking as a risk factor, you have to refer chapter 9 smoking and periodontal disease. Now in this chapter 27 they have not mentioned about the etiologic factor, so I have just mentioned here it. So what are etiologic factors? They are nothing but factors that directly initiate the disease process, and they are considered as necessary condition for the development of disease. For the risk factor, you refer this particular chapter. So that's all for today. We'll get back to you with the next few question answer sections from another set of new chapters. Okay, thank you. Hello everyone, welcome to the second session of question paper discussion, and today we will be discussing another set of 10 chapter questions. Thank you so much for your valuable opinions and support for the first section discussion. So moving on to the first chapter. that is the host response. The first question is a long essay. Describe the events in host microbial interaction and add a note on host modulation therapy. So first, answering, you have to answer first the definition of periodontitis. You have to write what is periodontitis, and then you have to add 3 headings. First is the microbial aspect of host microbial interaction, then the immunological aspect of host microbial interaction, and then the healing process of periodontium. So once you define periodontitis, second one, in the microbial aspect of host microbial interaction, first write about the bacterial colonization and survival. In bacterial colonization and survival, you have to write how the bacteria attaches to the tooth surface, that is with the help of fimbriae or surface protein or heat sensitive protein and all, and then how it survives in the periodontium. And then you have to write about the microbial mechanisms of host tissue damage. In that, you have to mention about the bacterial enzymes that are capable of degrading the host tissue. That comes under the microbial mechanisms of host tissue damage. Then the second heading, that is the immunological aspect of host microbial interaction. First, write about the innate factors and initiation of inflammation, which is done by the neutrophils. And then you have to write about the host mediators such as the proteases, then cytokines, prostaglandins, etc. And then the third part, that is the healing process of periodontium, you have to mention about what is repair, what is regeneration, what is the role of anti-inflammatory cytokines, and what is the role of the growth factors. So all these 3 headings should be added to describe the events in host microbial interaction. So once you have completed with that part, you have to add a note on host modulation therapy, which is the second part of the question, which you can refer in chapter 39, page number 440. And please draw the necessary diagrams. Moving on to the second question, that is the short note hypersensitivity reaction. So this question you must have definitely learned in your second year about the hypersensitivity reactions, and also the 4 types of reactions that are seen, that is the anaphylactic, cytotoxic, immune complex, cell mediated immunity, or delayed hypersensitivity. So you have to refer your microbiology book for this answer. Then coming to trauma from occlusion. So the long essay, what is trauma from occlusion? Describe the types and stages of trauma from occlusion. Briefly mention its role in periodontal pathogenesis. So here you have to refer chapter 20, that is the periodontal response to external forces in Carranza. Contents of this question is, first you have to define what is trauma from occlusion and then classify it. 2 classifications are given in our Carranza, that is the primary trauma from occlusion and secondary trauma from occlusion is one classification. Another classification is acute trauma and chronic trauma. And then once you have written about the classification, write about the stages of tissue response, that is the 3 stages: injury, repair, and remodeling. Then coming to the last part, that is briefly mention its role in periodontal pathogenesis. For that, you have to mention the Glickman's concept and Verhoek's concept for this part of your answer. Then please draw the necessary diagrams for this question. Moving on to second question, that is a short essay. What is trauma from occlusion? Classify it. Describe in detail about the pathologic stages of trauma from occlusion. The next question is also has the same answer, that is the tissue response to trauma from occlusion. So in both the questions, you have to write first define trauma from occlusion and then write one classification and then write the stages of tissue response. Moving on to the next one, describe trauma from occlusion and classify and add a note on its treatment. So the first 2 part has been already mentioned. Coming to add a note on its treatment, So I have written a few points here. You can refer to that. That is the treatment modalities for trauma from occlusion include. First, you can do occlusal adjustment. Then if the reason for trauma from occlusion is because of any parafunctional habits, you have to do the management of those parafunctional habits. Then if there is mobility, you can do splinting, or otherwise orthodontic tooth movement can be done, occlusal reconstruction can be done, and if it is severe case, then extraction of those selected teeth. Coming to short note, write the clinical and the radiographic features of trauma from occlusion. So for that, it's a straight cut answer from chapter 20, Periodontal Response to External Forces, page number 226. Coming to next question, that is pathological tooth migration. For this, you have to refer the chapter 20, the same chapter of trauma from occlusion, but the second, towards the end section, they have discussed about the pathological tooth migration, and you have to first define what is pathologic tooth migration, and then what is the etiology of pathological tooth migration, and then the treatment part. The treatment part is not given in Carenza, so I have briefly mentioned here. Even though if you are not studying this whole part, at least please mention the middle portion which I have written, that is the correction of pathological tooth migration, which can be divided into 4 categories, and these 4 categories you have to mention in the treatment aspect. Coming to the next chapter, that is the Periodontal Medicine. Short essay, describe the periodontal changes and its management in diabetes. So for this, you have to refer chapter 11, Influence of Systemic Conditions on Periodontium, page number 133. So the periodontal changes in a diabetic patient is mentioned there. And for the management of diabetes, you can give tetracycline antibiotics in combination with scaling and root planing. And while doing that, it has seen that it positively influences the glycemic control. And suppose if any surgery is needed in a patient with poor glycemic control, what you have to do is you have to give the prophylactic antibiotics. And also along with this, you can add upon the complications seen in the dental chair. So while doing some procedure, the most commonly seen complication in a diabetic patient is hypoglycemia or decreased blood glucose. So for that, we can write the treatment aspect. That is, we can give the patient some 4 teaspoons of sugar or some either fruit juice. In case the patient is unconscious, you can give 25 ml of 50% dextrose or 1 milligram of glucagon intravenously. And also another important point which you can add in this question is, add in this answer is, like we can ensure that the patient has taken his meal before the dental treatment. That is the most important thing you have to write in the management part of this answer. Coming to the next question, diabetes and periodontal disease. Again, refer the chapter 11. In more detail, they have mentioned it. Now coming to the short note, preterm low birth weight delivery and periodontal disease. This answer to this question you will find in chapter 25, Impact of Periodontal Infection on Systemic Health in Carenza, 2nd edition. It's not there in 3rd edition, so please refer the 2nd South Asia edition of Carenza. Moving to the next chapter, that is host modulation in periodontal therapy. First question is already discussed. Coming to the second question, sub-antimicrobial dose of doxycycline. So first, this is also a straight cut answer from host modulation chapter, page number 444. So here you have to mention what is SDD. Don't forget to mention STD is a host modulating agent. Don't write it is an antimicrobial agent. And also write about the periostat, its dosage, and for whom it is indicated. Coming to next chapter, bone loss and patterns of bone destruction. So first question is, define osteectomy and osteoplasty, enumerate the osseous defect in periodontal disease, describe the steps of resective osseous surgery. So the first part and the third part of this question you will find answer in chapter 48, resective osseous surgery. First, define the ostectomy, then osteoplasty, and write the 4 steps of resective osseous surgery, which is vertical grooving, radicular blending, flattening the interproximal bone, and then granulization of the marginal bone. Then for the second part, that is the enumerate osseous defect in periodontal disease. For that, you please refer chapter 19, bone loss and patterns of bone destruction. So like most of the students will write only about the vertical bone loss and horizontal bone loss. Other than that, there are many other bone defects such as osseous craters, bony contours, reverse architecture, ledges, Focation involvement and all. And whenever you are mentioning about the vertical bone defect, always mention about the 1-wall defect, 2-wall defect and 3-wall defect. Moving on to short essay, classify bone loss and describe the various patterns of bone destruction in periodontal disease. So this also you will find in chapter 19, bone loss and patterns of bone destruction. Vertical bone defects, same chapter, please refer, and don't forget to mention about the 1-wall defect, 2-wall defect and 3-wall defect. Now coming to aggressive periodontitis, long essay, define aggressive periodontitis, describe in detail the clinical features, immunology and microbiologic aspect of localized aggressive periodontitis. And then the second question is, describe the etiology, clinical, radiographic feature and management of localized aggressive periodontitis. Third question, classify periodontitis, discuss the etiology, clinical features, radiographic features of aggressive periodontitis and write a note on its management. So for this question, you can find answer in chapter 22, aggressive periodontitis. Okay, but while classification of when the question is classify periodontitis, please mention like chronic periodontitis, aggressive periodontitis, the 2 types, localized and generalized, and then also mention about necrotizing ulcerative periodontitis. But there's you must be familiar with the 1999 International Workshop for Classification of Periodontal Disease and Condition. So after that, in 2017, a recent classification has been introduced in which the aggressive periodontitis has been removed. It is no longer considered as a separate disease. So if they ask to classify periodontitis and if they are asking the question along with it about aggressive periodontitis, you can write chronic periodontitis, aggressive periodontitis and necrotizing ulcerative periodontitis. Okay, now coming to the management. For management of aggressive periodontitis, please refer chapter 31, treatment of aggressive periodontitis, page number 339. So the next question, short essay, etiology and radiographic features of aggressive periodontitis, and then clinical and radiographic feature of localized aggressive periodontitis. Everything will be there. The answer will be there in chapter 22, aggressive periodontitis. Coming to the next chapter, that is necrotizing ulcerative periodontitis, refractory periodontitis and periodontitis as a manifestation of systemic disease. The first question, management of patient with bleeding disorder. So for that refer chapter 11, influence of systemic condition on the periodontium, page number 135. So in that you have to mention about the neutrophil disorders, the neutropenia and also agranulocytosis, etc. About the leukemia, please never forget to mention about the leukemia. Coming to the next question, that is the gingival changes seen in vitamin C deficiency. So you have to write, give a small introduction about what is vitamin C, what are the sources of vitamin C. It's also called ascorbic acid and all. And then like what is the importance of vitamin C in periodontium. So the major protein of the periodontium is collagen. Okay, so the vitamin C plays an important role in the formation of amino acids which are almost like related to the collagen. Okay, so then you have to write about the 5 points, what happens when there is vitamin C deficiency, and 5 points. These are the 5 points here. The possible etiologic relationship between vitamin C and periodontal disease, the 5 points has been mentioned. if there is any vitamin C deficiency. That is also to be mentioned. Coming to next chapter, AIDS and the periodontium. They have usually asked the short note, the oral and the periodontal manifestation of HIV infection. So in this chapter 23, that is the pathology and management of periodontal problems in patients with HIV, in that chapter itself they have explained it in the table about the oral manifestation of HIV and the periodontal manifestation of HIV. About each one you should write at least 2-3 points. Coming to diagnosis of periodontal diseases. So the first question is how do you formulate the treatment plan for periodontal disease? So for the answer for this question, you can find in chapter 29, rationale for periodontal treatment and treatment plan in Carenza. And even if you don't explain anything, please draw the diagrams. These two diagrams, that is figure 29.1 and 29.6 from chapter 29, that diagram itself is enough for this question. Now coming to the last part of today's discussion, that is the drugs used in periodontal therapy. The first one is local drug delivery. You have to refer local drug delivery, tetracycline and metronidazole. All these three questions come from chapter. For these three questions you have to refer chapter 38, anti-infective therapy in Carenza. Okay, so coming to the local drug delivery. So whenever you're writing about local drug delivery, first define what is local drug delivery. Write the indications for like when the local drug delivery is indicated. Write the types of local drug delivery, and also mention 2-3 lines about each types. Then coming to next question, that is tetracycline. First write what is tetracycline, give a small introduction, then write the pharmacology, write the clinical use, write the dosage, and then write the semi-synthetic members of tetracycline group, that is minocycline, doxycycline and all. The third question, metronidazole. In this also give a small introduction about the metronidazole, then pharmacology, clinical use, dosage and also the side effects. You can also mention the side effect of tetracycline in this answer. Okay, hope this was helpful for you guys. So thank you. Again, if you guys have any doubts or query, please do clear them in the comment section. Okay, thank you so much. Hello everyone, welcome to the third section of Perio question paper discussion. So today I'll be discussing another 9 set of chapter questions. So coming to the first chapter, defense mechanism of the gingiva. First question, clinical significance of GCF. So the answer for this question you can find in chapter 3, defense mechanisms of the gingiva, page number 39. So in this question you have to write what happens to GCF when there is inflammation, when there is trauma from occlusion, mastication, gingival massage during ovulation, prosthetic appliances, smoking during periodontal therapy, and also you have to mention about the circadian periodicity. Coming to the second question, role of saliva in oral health. So for this there is a table that is given in Carenza, page number 41. It will be good if you guys can elaborate the table. Coming to the third question, that is the composition of GCF. For this question also there is a figure in Carenza, page number 39. You just have to draw that figure. Moving on to the next chapter, that is gingival inflammation. So the answer for both the questions is same only. First question is enumerate the stages of gingival inflammation with clinical and microscopic changes. And second one is the pathologic stages of chronic gingivitis. In both this question you have to write the 4 stages of gingival inflammation, that is the initial inflammation, early inflammation, established stage and advanced stage. Coming to the next chapter, that is the clinical features of gingivitis. classify gingival recession. So for this you have to refer chapter 51 and first you have to write what is recession, and then you can write about the classification. So two classification is there. Atkins classification is given in page number 563 of Kerenza, and Miller's classification in page number 565. Now coming to causes of gingival bleeding. So causes of gingival bleeding you can find in chapter Clinical Features of Gingivitis, page number 147. So gingival bleeding you have to write, it can be divided into local and systemic factors, and you have to mention the local factors and the systemic factors separately. Write 1 or 2 lines about each. And also along with that, there is for your reference, there is a table in Kerenza which lists out the causes of gingival bleeding. Coming to the next chapter, that is gingival enlargement. So the first question is classify gingival enlargement, describe the clinical and histological features of phenytoin-induced gingival enlargement and mention the mechanism. And the next question is classify gingival enlargement and discuss in detail about the drug-induced gingival enlargement. For both the question you have to refer the chapter gingival enlargement, page number 153. And whereas for the second part of the question, that is the clinical histological features of phenytoin-induced gingival enlargement, you have to refer page number 155. So there is a heading called anticonvulsants. So under that, whatever is written, you have to mention in the phenytoin-induced gingival enlargement. Histopathology is also given in that same page, 156 in Kerenza. Next question is short note on vitamin C. So first you have to write what is vitamin C, what are the sources of vitamin C, and what is the deficiency of vitamin C called. And then in this here, in the third paragraph, I have enlisted the possible etiological relationship between vitamin C and periodontal disease. I have enlisted few points. All these points has to be mentioned for this answer. Coming to next one, that is idiopathic gingival enlargement. Refer chapter gingival enlargement, page number 158. Under this question, you can add a slight introduction on what is idiopathic gingival enlargement, then write about the clinical features, write about the etiology, and then the histopathology. Then the drug-induced gingival overgrowth and clinical features of drug-induced gingival overgrowth, both you will find it's a direct answer. Gingival enlargement chapter you refer page number 155. Now coming to next question, that is a periodontal treatment protocol for pregnant women. So this was not given in Kerenza, so I have made it in few points. The 12 points are there. So first is like we have to give short appointments for the pregnant women because they can fatigue easily, they can get fatigued. And second one is gently we have to slow and straighten the chair. We should never do it fast. And then place the patient on left side or elevate the right hip. That much is enough. I have just added the extra for your kind information. Then advise non-alcoholic mouthwash for the patient, and also advise not to brush right after vomiting because it can cause erosion of the teeth. Then we have to recommend less flavored dentifrice and always recommend a small toothbrush, and no medication should be given which are toxic or has tetragenic effects on the fetus, and also the use of dental radiograph should be minimum. And if we are giving any if we are prescribing any drugs, then they should take the drugs after breastfeeding and then avoid the nursing for 4 hours or more. Then plaque control is necessary, and also if there is any pregnancy tumor that will regress after postpartum, but sometimes surgical excision is needed. So all these 12 points are needed for this answer. Coming to the next chapter, that is acute gingival infections. First, acute herpetic gingival stomatitis, causes, clinical presentation and treatment. For this you have to refer chapter 15 acute gingival infection. So first you have to write a small introduction on what is acute gingival acute herpetic gingiva stomatitis, and then you have to write the clinical features. Under clinical features, you can mention about the oral signs, oral symptoms, as well as the extraoral signs and symptoms. And then you have to write about the etiology, what causes the acute herpetic gingiva stomatitis. Then later you have to write about the histopathology and then the differential diagnosis. And for the treatment part, you can refer chapter 32, that is the treatment of acute gingival disease. Under that, you have to find the heading acute herpetic gingiva stomatitis. All the points has to be mentioned. Then coming to short note, clinical features of ANAC, refer chapter 15, acute gingival infections. And then pericoronitis also you can find in the same chapter towards the end, page number 168. Then coming to next chapter, that is periodontal abscess. Short essay. First, explain the etiopathogenesis, clinical features and management of periodontal abscess. You have to refer to chapter 18, abscess of the periodontium. And then for the management part, you have to refer chapter 33, that is the treatment of periodontal abscess. And then describe the clinical features and management of acute periodontal abscess. The same chapters you have to refer. Then coming to the next one, that is periodontal abscess versus periapical abscess. You have to refer chapter 18, abscess of the periodontium. And there in that chapter, there is a table available which has 7 points. All those 7 points has to be mentioned. Next chapter is desquamative gingivitis. So desquamative gingivitis and its management is the first question. So for this question, you have to first define what is desquamative gingivitis and then write a clinical, like general clinical features. If possible, you can give a classification also. And then for the management part, you have to write the management for each condition. For your reference, there is a table in Carenza where they have given the therapeutic approaches for each condition. The table is 16.2. So please refer that chapter 16. Then next short note, that is Lycan Planus. For that same chapter, desquamative gingivitis, page number 180. And here for this question, first you have to write what is Lycan Planus, and then you have to write whom it is seen, whether it is females or males, and then the prevalence, etc. And then the oral lesions, the gingival lesions seen in Lycan Planus, and then the histopathology. When you are writing histopathology, always mention about the immunofluorescence, and then the differential diagnosis, and then the treatment part. Coming to the next one, that is the periodontal pocket. Define pocket, describe about the pathogenesis of periodontal pocket. Refer chapter 17, periodontal pocket. Write definition of the pocket first and then mention any 1 or 2 classification and then describe the pathogenesis. Coming to short note, differences between suprabony and infrabony. That also same chapter, periodontal pocket, you have to refer. First write the definition and then write about the differences between suprabony and infrabony. Coming to next, that is the root surface wall changes in periodontal pocket. So in the root surface changes, you have to mention about the 3 main changes. That is, first is the structural change, second is the chemical change, third is the cytotoxic changes. So in structural change, you have to mention about the role of pathologic granules. And in the second one, that is the chemical changes, you have to mention about the mineral content. And then in the third one, that is the cytotoxic changes, you have to write about the role of endotoxins. Then for more, you can refer page number 201 in periodontal pocket chapter, Carenza mein. Then next one is etiopathogenesis of pocket, that you can find in the periodontal pocket chapter, Carenza, page number 195. Coming to the last one, that is the determination of prognosis. So define prognosis, explain the factors affecting overall prognosis. Next question is define prognosis. What are the factors to be considered for individual tooth prognosis? Third question, define and classify prognosis, described about factors affecting it. For this question, you have to refer chapter 28, determination of prognosis in Carenza, page number 302. So the contents for all the answer I am telling all together. So first what you have to do is you have to define what is prognosis,
and then write the classification of the prognosis, that is the excellent, good, hopeless, questionable, etc. And then you have to classify the prognosis, that is into overall clinical factors and then into individual clinical factors, and then you have to mention about each one under it. So overall clinical factors will come like systemic and environmental factors, and under individual clinical factors will come the local anatomic and prosthetic and restorative factors. There is a table given in Carenza, so please refer this chapter. Then coming to the short note, describe the various factors determining the individual tooth prognosis. So the same, you have to mention about the local anatomic and prosthetic and restorative factors. Then enumerate the factors affecting prognosis, as I already discussed. Then next question is tooth mobility. Tooth mobility, you have to refer chapter 25, periodontal examination and prognosis. So first you have to define what is mobility and then write the classification of mobility. Then you have to mention about the 2 stages of the mobility and then how to check the mobility, that is with the help of the 2 mouth mirrors. And then also mention about the causes of mobility. That much is enough because it's a short note. And then assessment of individual tooth prognosis and periodontitis, that is already discussed. So that's all for today's section. We'll get back to you tomorrow with another set of questions. Thank you so much. Hello everyone, welcome back to the 4th section of the Perio question paper discussion. Today I'll be discussing questions from another 12 chapters. Most of these chapters are either diagnosis related or treatment related. So coming to the first chapter, that is pathogenesis of periodontal disease. Short note, pro-inflammatory mediators. So for this question, please refer chapter 7, periodontal disease pathogenesis in Carenza, page number 87. So for has contents, first you have to define what is periodontitis and then mention the pro-inflammatory mediators. The most common pro-inflammatory mediators are cytokines, MMPs and prostaglandins. You have to write at least 2 to 3 lines about each of them. Moving on to the next chapter, that is risk factors. So define and enumerate risk factor, explain in briefly about various risk factors in periodontal disease. For this, refer chapter 27, clinical risk assessment. So content mein you have to write what is risk factor and enumerate the risk factors, that is first is tobacco or smoking, second is diabetes, third is pathogenic bacteria, fourth is microbial tooth deposits, and you have to write at least 3 to 4 lines about each of them since this is a short essay. Then moving on to next question, that is risk indicators, risk markers and probability of periodontal disease. For this also you have to refer the same chapter. You have to enlist what are the risk indicators and what are the elements coming under risk indicators such as HIV, osteoporosis and infrequent dental visit. And then coming to risk markers, you have to write which all elements come under risk markers, that is the previous history of periodontal disease and bleeding on probing, and then 2 to 3 lines about each of them. Coming to the next chapter, that is advanced diagnostic aids. Long essay, enumerate the indication of radiographs in periodontics, discuss the advances in radiographic aids. For this you have to refer chapter 26, radiographic aids in the diagnosis of periodontal disease in Carenza. So coming to the indications of radiographs, there are so many indications. First you can write it helps in the diagnosis of periodontal disease, it helps in the determination of prognosis, and then for the evaluation of outcome of treatment, for detection of periapical lesions, then also for the placement of implants, that is to assess the vertical height of alveolar bone for the placement of implants. So there are so many indications. You have to enumerate the indications of the radiographs. And then coming to the second part of the question, that is the discuss the advances in radiographic aids. For that you can write about CT, MRI, CADIA, CBCT, then radioisotope scanning, then about the subtraction radiography, and then also about the digital radiography, and at least like about 2 to 3 lines about each of all this. Moving on to short notes, DNA probes. So DNA probes are nothing but advanced diagnostic probes, and then you have to write the 4 types of DNA probes that is available. and then you have to enlist the advantages as well as the disadvantages of DNA probe, and you will get extra marks if you write how DNA probes help in microbial detection. For this question you can refer Sahitya Reddy. Moving on to next question, that is periodontal probes. So in this question, first you have to write what is a periodontal probe. You have to explain the design of a periodontal probe, then what are its uses, and also the classification. That is the 5 generation of periodontal probes you have to enlist. Next is short essay. Describe the various advanced microbiological diagnostic aids used in periodontics. So for this, first you have to define what is periodontitis, and then you have to write the indication of microbial analysis. Why we have to do microbial analysis? First is for the initial diagnosis and treatment planning. And second is to monitor the treatment efficacy. Third is to determine if there is any active sites of tissue destruction. Fourth, to select appropriate recall interview. Fifth, for prevention of periodontitis in person at risk. And sixth is to identify antibiotic susceptibility of the infecting organism. So there are like 6 reasons why we do microbial analysis. And then you have to list out various diagnostic aids. So first one is the cultural technique, and cultural technique you can divide into 2, that is aerobic cultural technique and anaerobic cultural technique. Then next comes to direct examination, where light and dark field microscopy comes. And then you have to write about ELISA test, then flow cytometry, immunodiagnostic methods, where you have to write about direct IFA as well as indirect IFA. Then about DNA probes, BANA test, then commercial diagnostic kits such as Periocheck. Periocheck is used to detect the presence of neutral proteases such as collagenase. And whereas PerioGuard, it is a rapid chairside kit for detection of AST. Then also there are advanced diagnostic aids which check the presence of connective tissue degradation products such as collagen, proteoglycan, fibronectin, etc. And also there are aids which check the products of bone resorption and formation such as TRAP and glycosaminoglycans. Hope I am clear. Moving on to next chapter, that is treatment plan. So enumerate the periodontal pocket management procedures. Discuss the role of phase 1 therapy in treatment of periodontal disease. So for the first part of the question, that is enumerate the periodontal pocket management procedure. It can be divided into 2 types, that is pocket elimination techniques and pocket reduction techniques. So under pocket elimination flap procedures comes Whitman flap, then undisplaced flap, and apically displaced flap, and gingivectomy. Gingivectomy you have to write only if there is presence of suprabony pocket. In case of infrabony pocket, we don't do gingivectomy, we do flap procedures. Then the pocket reduction flap procedure comes modified Whitman flap. There are 2 types of Whitman flap. One is the original Whitman flap, another is the modified Whitman flap. So make sure you write original Whitman flap under pocket elimination flap procedure and modified Whitman flap under pocket reduction flap procedure. So once you have enlisted this, you have to write the second part of the question, that is discuss the role of phase 1 therapy in treatment of periodontal disease. So for that you have to refer chapter 34, phase 1 periodontal therapy in Carranza, page number 358. You have to enlist each elements of phase 1 therapy and write at least 2 to 3 lines about it. Then moving on to next chapter, that is rationale for periodontal treatment. First question, enumerate the rationale of periodontal therapy and add a note on wound healing and factors affecting wound healing. So for the first, the rationale of periodontal therapy, you have to refer chapter 34 and 42, where you have to write the rationale of phase 1 periodontal therapy and phase 2 periodontal therapy. So it's given in Carranza in page number 358 and 468. And then moving on to the second part of the question, add a note on wound healing and factors affecting wound healing. So first you have to write what is wound healing, and then factors affecting wound healing you have to write about the local factors, the physical factors, general factors and miscellaneous factors. And then you can also write about the grading of healing, and then about the healing rates of each component of periodontium, that how many days junction epithelium take for healing, how many days circular epithelium and then epithelium, connective tissue and alveolar bone takes for healing. For grading of healing, there is like 1 star, 2 star, 3 star, like it's given in the form of stars. So 1 star is control of inflammation. If they are given 2 stars, that means there is presence of long junction epithelium. 3 stars means there is new attachment. 4 stars, there is partial regeneration, whereas 5 star is given for complete regeneration. Then coming to next question, that is healing following the free gingival grafting. It's a direct cut answer in chapter 51, Periodontal Plastic and Aesthetic Surgery, page number 562. Coming to next one, that is splints in the periodontal therapy. So first you have to, first question is describe the type of splints and its role in periodontal therapy. So for here, first you have to write what is dental splints, and then you should mention at least 2 to 3 objectives of splinting, then classification of splints, uses. And then coming to the types of splint, you have to write it can be either extracoronal or intracoronal. Under extracoronal comes welded bands, continuous clasp, Rochette splint and night guards and wire ligation. Intraoral splints comes acrylic, composite, amalgam and stainless steel splints. You have to write 2 to 3 lines about each of them. Then types of splinting is already discussed. Then enumerate various advantages of using dental splint. For this question also, first define what is dental splint, write 2 to 3 objectives of splinting, and then advantages I have enlisted here. You can please refer here. Then coming to next chapter, that is role of systemic disease in the etiology of periodontal disease. Influence of vitamin C on periodontium I have already discussed in the third section. And then coming to next chapter, that is influence of periodontal disease on cardiovascular disease. So here first you have to write what is periodontitis, and then you have to mention few cardiovascular diseases such as ischemic heart disease, systemic infection, atherosclerosis, thrombogenesis and daily activity, and you have to write 2-3 lines about each of them. The answer for this question you can find in chapter 24, impact of periodontal infection on systemic health, page number 260. Then coming to periodontal instrumentation, differences between Gracie curettes and universal curettes. So for this you have to refer chapter 36, periodontal instruments and instrumentation, page number 386. So 4 points are there in one table. Along with that, you have to add example for Gracie curette as well as universal curettes. So total 5 points will be there. Coming to area specific curettes. So area specific curettes also you can find in chapter 36, page number 384. Now coming to dental implants. First is peri-implantitis. For this you have to refer chapter 62, peri-implant disease management and supportive implant therapy, page number 720. First you have to define what is peri-implantitis, then classify the peri-implant disease and condition, and then you have to write about the examination. Under examination you have to write about the microbial testing, stability testing, the periodontal probing and also the radiographic examination. And then you have to write about the treatment. So treatment for peri-implantitis, it can be surgical as well as non-surgical. And then you have to mention about the cyst protocol also given by Lang et al. Then moving on to next question, that is osseointegration. Osseointegration you can find answer in chapter 58, biological aspects of dental implants. Then coming to next one, that is dental implants. For dental implants you have to write first define what is implant. You can write mention about the implant geometry, surface characteristics, then standard implant procedures, and then implant failures and complication. All these headings can be included under this question. Next question is peri-implantitis, I have already discussed. Then coming to next question, that is implant bone interface. So implant bone interface, there can be of two types, that is either osseointegration or fibrointegration. So osseointegration, you have to, it is means like between the implant and the bone, implant and like bone is deposited. Whereas in fibrointegration, it means fibers are integrated between implant and bone. Okay. And in osseointegration, you have to write the 3 stages also. That is, first is the woven bone formation, second is the lamellar bone formation, and third one is the bone remodeling. So these 3 stages you have to write under osseointegration, and then you have to write about the fibrointegration. Then factors affecting osseointegration you can find in chapter 58, biological aspects of dental implants, page number 648. Then coming to principles of periodontal surgery, the principles of suturing. Principles of suturing, it is the Ethicons principle. There are 12 principles he has enlisted. You should write each and every one of them. Coming to principles of periodontal surgery. So what is periodontal dressing? For this you refer chapter 44, general principles of periodontal surgery in Carenza, page number 485. First, you have to define what is a periodontal dressing, what are different names for periodontal dressing, what is the purpose of periodontal dressing, properties of periodontal dressing, classification. Under classification, you have to write like zinc oxide eugenol dressing is there, zinc oxide non-eugenol dressing, then barricade, that is a light cure periodontal dressing is there, then collagen dressings are there. So a classification on periodontal dressings is needed. And then you have to write about the post-operative instructions, what post-operative instructions we give once we have placed the periodontal dressing. Then coming to next question, that is non-eugenol pack. Non-eugenol pack, you have to refer chapter 44, general principles of periodontal surgery, same chapter, page number 486. Then the next question is already discussed. Then coming to sling suture. Sling suture you can find in chapter 46, periodontal flap, and in that you have to write first what is suture and then write what is sling suture. So it's there in page number 502. Then coming to endoperio lesions. So the questions asked are types of pulpoperiodontal lesion and classify pulpoperiodontal lesion. So both questions answer are same only. Refer chapter 54, diagnosis and management of endodontic periodontal lesion in Carenza, page number 605. In that there will be Simon, Glick and Frank classification. You have to write the 4 classes. Coming to the next, that is the maintenance phase of supportive periodontal therapy. So short note, objectives of phase 1 therapy, that was already discussed. You have to refer phase 1 periodontal therapy chapter, page number 358. Then coming to supportive periodontal therapy, refer chapter 57, supportive periodontal therapy in Carenza, page number 633. So here first you have to write what is supportive periodontal therapy. Then you have to write the sequence of periodontal treatment phase, and then the rationale of SPT, the maintenance recall procedure, that is divided into 3 parts. That is, first is examination, second is treatment, third is scheduling. You have to write how much minutes they do examination, how much minutes they do treatment, and how many minutes they do scheduling. And then you have to write about, mention about the Merin classification. So that's all for today's section. We'll get you back tomorrow with another set of questions. Thank you so much. Hello everyone, welcome to the final section of Perio question paper discussion. I'll be discussing the final 8 treatment aspect chapters today. So coming to the first chapter, that is plaque control. Describe in detail the mechanical plaque control measures and chlorhexidine as an anti-plaque agent. So for this you have to refer chapter 35, plaque biofilm control in Carenza, page number 363. So first you have to define what is plaque control, and then you have to write the types of plaque control, that is mechanical and chemical, and give few examples for each. For mechanical, like toothbrush, power toothbrush, interdental aids or ligation, whereas for chemical you have to write the different types of mouth rinses. And then coming to the second part of the question, that is chlorhexidine as a anti-plaque agent. For that, you have to first write what is chlorhexidine. Then you have to write about the dosage, that is 2 daily rinses with 10 ml of 0.2% chlorhexidine. Whereas in US and all, they recommend about 0.12% of chlorhexidine. And then what happens when high concentration of chlorhexidine acts on bacteria, what happens when low concentration acts. And then moving on to the second question, the factors to be considered before recommending a modification in patient brushing technique. Okay, so for here also, first you have to define what is plaque control, then types of plaque control, mention the different brushing techniques and for whom it is recommended. That is, in case of patients with periodontal disease, we recommend sulcular technique, whereas patient with gingival recession, we recommend Stillman's technique. And for patients after periodontal surgery, we recommend the Charter's technique. The most commonly used brushing technique is Barr's technique, and also for whom the power toothbrushes are recommended. So all these things should be written. Moving on to the next one, chlorhexidine, that is already discussed. Then coming to classify antimicrobial agents with example. So here you have to write about antibiotics. So this you must have studied in pharmacology in second year itself. So like antimicrobial can be divided into bacteriostatic, bactericidal, and you have to give examples for each. For example, like bacteriostatic can be tetracycline, and bactericidal is penicillin, ampicillin, amoxicillin, etc. And also you can classify according to the compounds, that is metronidazole belongs to nitroimidazole, ciprofloxacin belongs to quinolone, and erythromycin and azithromycin belongs to macrolides. Okay, so like that you have to classify the antimicrobial agents. Moving on to next question, that is subgingival irrigation. For this you can find answer in chapter 35, plaque biofilm control, page number 374. So first you have to define what is oral irrigation, and then you have to write about two types of oral irrigation, that is supragingival and subgingival irrigation. Then you have to write about the mechanism of action of subgingival irrigation, and then what is the technique of subgingival irrigation. That is enough. Then desensitizing agents I have already discussed in paper 1 in the perio first discussion video. Moving on to the next question, that is gingivectomy. So define gingivectomy, describe in detail the indications, contraindications and procedure. And then next question is indication, contraindication, advantage, disadvantage in healing. Whereas the third question is explain the gingivectomy procedures by various methods. Okay, so for all together I will give a single reply. So you have to refer chapter 45, gingival surgical techniques, page number 492. First define gingivectomy, write the indications and contraindications, and for the procedure of gingivectomy they have mentioned 5 steps in Kerenza, mention all those. And for healing of after gingivectomy they have given in page number 493. So healing can be divided into like 5 steps. First you have to write about the initial response, like immediately after gingivectomy what is the initial response of the gingiva, what happens then after 24 hours, and then after 3 days, then after 2 months, 2 weeks, what happens, that is the surface epithelium is completely formed, and then what happens after 7 weeks, that is the connective tissue is completely healed. So that is about the healing part. Then coming to the various methods, that is also given in the same chapter, page number 494. Various method includes the scalpel method, of course, that is already discussed. Then you have to mention about the electrosurgery, chemosurgery and the laser. Next chapter is periodontal flap. Define and classify flap. Discuss in detail about modified Widman flap. So first you have to define what is a flap, and then you have to classify flap. So flap classification is given according to 3. That is, first one is flap exposure after reflection, and then second classification is based on flap placement after surgery, and third classification is based on the management of papilla. So all these 3 classifications should be mentioned for this answer. Then coming to modified Whitman flap, you have to first tell what is modified Whitman flap, give a small introduction about it, and then you have to write the 7 steps involved in modified Whitman flap, and diagram is a must for this question. Then coming to short essay, what are the indications of flap surgery? Discuss in detail about apically displaced flap. So for this you have to refer chapter 46, Paradontal flap. So in the same, the first page itself, they have given the indications of flap surgery. 8 points are there. Now moving on to apically displaced flap. First you have to give a small introduction about apically displaced flap, and then you have to write up 5 steps of apically displaced flap, and then the diagram. Then coming to next question, that is incisions in flap surgery. So for that you have to refer chapter 46, Paradontal flap, page number 498. So the incisions, they are mainly of 2 types, horizontal and vertical. Horizontal can be further divided into internal bevel incision and clavicular incision. You have to write like 2-3 lines about each of them. Next question is also the same, various incision used in flap surgery, and then apically positioned flap also I have already discussed. Next chapter is regeneration. First one, GTR. So GTR is a very important question. So you should know what all you have to write under this question. So first you have to define what is regeneration, and then you have to come down, write about what is GTR, then the principle of GTR, and then the classification of GTR, that is the absorbable and non-resorbable membranes, and then you have to write about the indications and contraindications, and then you have to write about the surgical procedure of GTR. There are like some 6 to 7 steps for that. And then lastly you have to write the factors affecting the clinical outcome of after GTR placement, and that can be divided into barrier dependent and barrier independent factors. So all these headings should be included when GTR is asked as a long essay. Moving on to next question, define new attachment, enumerate various methods to achieve new attachment, and describe about graft associated new attachment methods. So first you have to define what is new attachment. So new attachment is nothing but the embedding of new periodontal ligament into new cementum that was previously denuded by disease. And then after that you have to write about, like, there are, to achieve new attachment there are 2 types. We can achieve by 2 methods. First is graft associated reconstructive procedures and non-graft associated reconstructive procedures. Then graft associated reconstructive procedures is the bone graft materials. You have to write about all those classification and in detail about them. And then coming to non-graft associated reconstructive procedures, you have to write about the root biomodification. You can write about even scaling, root planing, curettage, then LANAP, that is laser assisted new attachment procedure, and also you can include GTR. So all these things comes under the methods to achieve new attachment. Then classify bone grafts, describe the treatment option grade 2 Focation defect. For this you have to refer chapter 49, Periodontal regeneration. They have given the classification of bone graft. So 3 classifications has been given. First is based on origin, and then second one is based on the mode of action, that is osteoconductive, inductive, okay, and then comes based on the rate of resorption, like the bone graft resorption rate. It can be fast resorbed, slow resorbed, or non-resorbing. So these 3 classifications should be written in this question. And then describe the treatment option for grade 2 Focation defect. It includes, first is the open flap debridement, and then you have to mention about the GTR, and then about the bone grafts. So these are the treatment options available for grade 2 Focation defect. Next question is short essay on describe the rationale and procedure for GTR, that has already been discussed. Next is allograft. So allograft may first you have to write what is a bone graft, then come and define what is allograft, and then you have to mention the types of allograft, that is freeze-dried bone allograft as well as demineralized freeze-dried bone allograft. And then you have to write how it is obtained, how we prepare this FDBA and DFDBA. Then coming to enamel matrix proteins, first again you have to define what is regeneration, then you have to write what is EMD. The commercial name of EMD, it is called Emdogain, and then you have to write the indications of EMD, then clinical application, and then mechanism of action of EMD. That much is enough for a short note. Then autogenous bone grafts. Autogenous bone graft also, first define what is autogenous bone graft. Then you can write about the bone from intraoral and extraoral sites, from where all we can take intraoral and extraoral sites. And then you have to mention about bone blend, osseous coagulum, and also about the bone wedging. Then classify bone graft materials used in periodontics, that is already discussed. Then enumerate the various steps of resective osseous surgery. This has been already discussed in the previous session. So there are 4 steps in resective osseous surgery, that is vertical grooving, radicular blending, then flattening the interproximal bone, and gradualization of the marginal bone. So all these 4 steps should be written. Then coming to alloplast. Alloplast, first you have to define what is alloplast. Then you have to write about the commonly used components of alloplast, that is calcium phosphate, hydroxyapatite. Then you can mention about the bioactive glass, etc. Then citric acid in root biomodification. It's a straight cut answer from Carranza, chapter 49, page number 545. Then osseous coagulum. Osseous coagulum also you can find in the same chapter. It will come under autograft. Then coming to next chapter, that is mucogingival surgery. First is enumerate root coverage procedures, discuss in detail about subepithelial connective tissue graft. So first all the root coverage procedures you have to mention, and then about the subepithelial connective tissue graft, first give an introduction about it, then the indications and contraindications, and then the procedure. Define a free gingival graft and describe the procedure for free gingival graft for recession coverage, that was already discussed in previous session. Then classify recession and describe management of class 2 recession, already discussed in previous discussion. Then laterally displaced flap. So laterally displaced flap, first thing is you have to write what is lateral displaced flap. Then you have to write about the indication, contraindication, and the procedure steps. And you can also mention about the variant stages, variant techniques of lateral displaced flap. And then diagram is necessary for this question. Then classify recession and describe management of class 2 recession by soft tissue autograft. Okay, so for classification you have to refer chapter 51, page number 563. Atkins and Miller's classification is there. And then for management of class 2 recession by soft tissue autograft, for free gingival graft refer page 560. For apically displaced flap 563, laterally displaced flap 567, coronally advanced flap. Along with that you have to mention about semilunar flap. Both you can find in page number 568, and then about the connective tissue graft in 569. You will get extra marks if you mention about the other techniques such as the GTR, pouch and tunnel, pinhole technique, Vista method, Zucchelli's technique, and use of Ursula dermal matrix, then dentogingival transfer and periosteal transfer. Coming to the next chapter, that is Focation Involvement. So classify bone graft and describe the treatment option for grade 2 Focation defects, that is already discussed. Second question, classify Focation Involvement and explain the rationale and management of grade 3 Focation Involvement. So classification of Focation Involvement you can find in chapter 50, page number 553. You have to mention 2 classification at least. One is the Glickman, that is most important, and second one is Ham-Patel classification, that is also available in Carranza. And then you have to write about the management of grade 3 Focation Involvement, which includes open flap debridement, then use of bone graft, then the tunnel preparation. Then you have to mention about root resection, hemisection, and tooth resection. Management of grade 2 furcation is already discussed. Next question is hemisection. Hemisection, you can write first define what is hemisection, then you can write different names for the hemisection, that is bicuspidization and all. Then indication, contraindication, advantages, disadvantages, and then the procedure for hemisection. Coming to next, that is occlusal evaluation. So occlusal evaluation mein the most commonly asked question is steps in coronoplasty. So first you have to define what is coronoplasty, when it is done, that is in the indications you have to write, and then the 9 steps of the coronoplasty should be mentioned. For each step you have to write at least 1 or 2 lines. Then coming to the last chapter, that is the periodontal restorative interrelationship, biological width. So biological width also you can find in chapter 55, periodontal restorative interrelationship, page number 611. So here first you have to write what is biological width, and then you have to write the clinical significance of biological width. Then how do you evaluate biological width, that is with the help of transgingival probing or sounding. And then in case if the biological width is violated, how do you correct it? So all this heading should be included under biological width. So that's the end of our perio question paper discussion. If you feel I have missed out any topics, please let me know through the comment section. Okay, thank you so much.